Hi, welcome to the 5 minute video study for the NCE. Today we are in clinical focus and we are under AH, which is stress management in counseling. So, stress is a response that is universal to all humans. And what is individualized is the triggers, and those are dependent on many circumstances. Some of those circumstances can include age, developmental stage, trauma, previous coping mechanisms. So it can be a multivariate factors of responses, and what could be considered stressful for one person may not be stressful at all for someone else. And again, that's why it's so individualized, because different people learn to manage it or to cope in a very different way. So in counseling, stress management is one of the skills that is frequently talked about, and that to me is just looking at that response, the mind-body connection, and it's also a physiological connection. There's been studies where there's a role of stress response on your digestive system, on your sleep habits. So it's not just the mental aspect. It's also the physiological aspect that could have consequences to your health as well as your mental health. So understand that. Understand the fight or flight response, which is either a activation of stress, and understand the chronic stress, right, which is a serious, prolonged notion of a over saturation or overdose of stress, and that could again lead to many health concerns. Some of those could be heart disease, strokes, headaches, inflammation, pain, sleep disturbance, anxiety, and depression. So part of stress management is understanding what your body needs, how your body reacts to things, and just awareness of some of the triggers and some of the over the edge things that that worsen the conditions. We can't totally eliminate it, but we can certainly manage it, and I think that's a healthy way of putting it for many clients, right? Because I can't eliminate the discomfort, but I can teach you skills and reframing so that discomfort can be more manageable for you. In mental health, stress has been linked to anxiety, depression, insomnia, as well as other issues. And then how it affects the mind, it creates worry, difficulty concentrating, difficulty with memory, brain fog, and then also, it can change creativity and problem solving. Other things to consider with stress management, and these are some of the interventions, is to increase your awareness, right? What are my triggers? When do they happen? How long have they happened? What is my history of the way that I cope? Understanding your locus of control, right? What are some things that I can control versus what are some things that are out of my control, right? And which one should I focus on? Limit your intake of news and social media. When you consume or over consume those types of messages, it can trigger those types of responses, and then understand the purpose as well as implement some of the relaxation strategies, right? Mindfulness, meditation, exercise, aerobic exercise, any type of yoga or kind of that mind-body connection is recommended, as well as touching base with nature, right? Going on a walk, looking at trees, being that connection, and then looking at your relationships, right? We are social creatures. Having those connections, being vulnerable with someone, right? Hey, do you have some time? I kind of want to connect with you because I've been really stressed out, and I'm just trying to see if this connection could help both of us. And then nourishing your body, what do you need? Do you need sleep? Do you need nutritious food? Do you need water? Are you lacking vitamins? And then, looking at healthy practices and routines. I think those are important. That creates consistency, that creates your body kind of knowing what to expect. So those are just some things that fall under the stress management as it relates to counseling.